help us try to get control of this COVID-19 crisis. So I, again, want to really thank them. We're still in the coronavirus crisis. Under the state's measurement system, the county is still red, which is bad, and the federal government recently called out 11 cities with serious COVID problems, and Cleveland was one of them. As you'll hear in a moment from Commissioner Allen and Dr. Gullett and Ramona Brazil, things are still problematic. What can we do about that? Well, it's pretty simple. Follow the guidance from the CDC, from Governor DeWine, and from our local Board of Health. Don't gather in large groups, stay socially distant, and wear a mask. I know we're all fed up with this whole situation, but until we can do the right thing for ourselves, for our families, and our friends, and the entire community, we simply aren't going to get ahead of this. Masks are so important to stemming the surge of the coronavirus infections. We must take the steps necessary to protect ourselves and our families and others. Many of you have been using our mask hotline to report your experience with people abiding by or not abiding by the mask requirement. We've already sent about 1,400 letters to businesses to convey your concerns. But today I want to talk about movies and bed bugs. That's right, movies and bed bugs. Before picking a movie to watch, many of us go online to check out fan sites like Yelp or Rotten Tomatoes to get the rating to see what other people thought. And before going to a hotel, many of us would check out a rating site to see if others had found bed bugs there. These kinds of sites help all of us make good decisions about which movie to see or which hotel to stay at. They depend on the public to register their votes, their views, their experiences. Well, that's what we're moving to with our Mask Experience site. We've created a website which we're asking people to fill in with their mask experience. And your experience could be good or bad. I want to take a moment to go through what you can expect when you go to cuyahogacounty.us/masks. Before you make a report, you need to enter some very simple information like your email address and your phone number and the date and time of your observation. Next, you'll be asked to provide the name and location of the business that you're providing information about and what type of business it is. Adding your observations is quick and it's easy. All you need to do is answer a few yes or no questions about things like whether or not employees are wearing masks and if customers are wearing masks. You can also report on sanitizing procedures and social distancing. All this data goes into a map of Cuyahoga County, and you can see at a glance how businesses generally are doing. And you can drill down to a specific location to see how a specific business is doing. The data you're seeing here has all come from our hotline, which was really operating as a complaint line. My hope is that if you see a business is practicing good protocols, that you'll take the time to tell people that as well, so we can see the good and the bad actors. And what's on the screen now is what you'll see when you drill down to a specific site, to a specific business. Businesses that are following good practices will show up on the map with a green dot. Businesses that are following none of the practices will show up with a red dot. And businesses that are following the practices partially will show up as yellow. This will apply to all sorts of businesses, including bars and restaurants, grocery stores, gas stations, and more. This is live now, and it's available to you to check before you patronize a local store or business. This will give everyone a way to shop comfortably, and hopefully it'll give establishments an incentive to urge their patrons and staff to wear masks. I want to thank a lot of people who have put this together and made it as easy as possible for people to report and for people to see. Catherine Tkachuk, our GIS team here at the county, and a number of others. Thank you for your good work here. So you can go to our website, cuyahogacounty.us/masks, to submit your experience with a business. Good or bad, submit your experience. Or if you want to go there just to check out a business before you go to visit it. Working together, we can get this virus under control. I believe it, and I have faith in the people of Cuyahoga County. Thank you.
Thank you, Armond. That was wonderful to hear, and as always, we're very grateful for your partnership in this fight against COVID. And it is a fight, it is a war that we are in as a community, as a state. And so from the beginning, you've been incredibly supportive of us here at the Board of Health, and we appreciate that, and this new development around what you're doing with masks so that people can make good, sound, safe choices based on risk. I think that that's a great development, and we appreciate that enhancement and continuous improvement of the website. So today we will be talking a bit about some highlights from our Epi brief, which is now posted on our website as is customary at ccbh.net/coronavirus. And so you'll hear from our co-director of prevention and wellness, Ramona Brazil, and Dr. Gullett as well. So what are the key points? Continuing as it has for quite some time, as we continue to see widespread community transmission in Cuyahoga County. Executive Budish talked about our level is red. Currently we remain red, and we're now joined 23 counties in total that have met this red designation. So that number has been growing, which also is an indication of community spread around the state. While we remain red, we continue to watch and work closely with our partners, hospital partners and others, to look at inpatient, outpatient data trends, as well as COVID test positivity rates. We appreciate the leadership of Governor DeWine in establishing a statewide mandatory masking order for Ohio. We think this is sound public health practice. As we've discussed in the briefings over many months, the data is clear that masks prevent the spread of COVID-19, save lives, plain and simple. Dr. Redfield, the director of the Centers for Disease Control and Prevention, recently pointed to new studies that further validate that masks work, both in and out of the clinical setting. Dr. Redfield stated that, quote, "The data is clear that masks work. Masking is not a political issue. It is a public health issue. It is really a personal responsibility for all of us. If we embrace masking, we really embrace the social distancing and hand washing as well, we could bring this outbreak to its knees." A best practice is for businesses to post a sign indicating that the masks are required upon entry to any business under the state order. We find that if businesses are posting these signs, that folks will stop and grab the mask from their car or out of their pocket, and they'll put it on before they go into an establishment. And this also will provide for a better masking experience data that you can share through the county website, and then make those choices on businesses that are being responsible and masking appropriately. At the last briefing, I shared the compelling data from CDC that relates back to Dr. Redfield's statement. Among 139 clients of 2 symptomatic hairstylists that had confirmed COVID, both stylists were wearing masks, and so were their 139 clients. And no symptomatic secondary cases were reported. Among that 139, 67 of those clients got tested, and they were all negative. All of them were negative. An incredibly powerful story and very strong data to indicate the value of masks. So it's important to understand that masks work, they save lives, and often the 2-ply masks are the best. If you can get 2 layers of cloth, that's better than 1 layer in terms of protection. And the more we practice this, not just in work spaces, which many of us do, but to take those practices home with you into places where you may go and meet with friends at parties, into restaurants or bars when you're not exactly eating something in that moment, that you're using masks for protection. It's a sign of respect for your neighbor. So as you'll see from the data brief, we continue to see that almost 40% of our cases are occurring with younger folks between ages 20 and 40. So my message to those young folks is that when we call you, when we text you, if you're a positive case, please pick up the phone. We want to hear your story. We want to hear how you're doing, how you're feeling in that response. And we've heard lots of responses in terms of folks having mild symptoms to folks really being in a tough spot, having severe symptoms, and some folks hospitalized. So this is not a casual matter, and it's about your health, and it's about the health of your grandparents, about the health of your neighbor that you may come in contact with and unknowingly expose. So to date, we know among the hospital systems that approximately 240,000 tests have been conducted in Cuyahoga County since the beginning of the pandemic, and over 6,000 tests have been performed in the partnership with the Cuyahoga County Board of Health and Metro that's funded by Executive Budish and Cuyahoga County Council, and you'll hear more about where we stand on that data from Dr. Gullett. As we watch our numbers, we continue to cautiously watch the weekly data, case numbers, and testing positivity rates to see if the downward trend that we're seeing slightly this week continues. As Ramona and Heidi provide the details in their updates, I'd advise caution in focusing not on a single week of data as a trend. We look at multiple weeks of data to indicate a trend, and please remember that the short answer is just too early to tell if we're beginning to trend down or we're plateauing in this particular surge we're seeing. From the beginning, we've seen a pattern of case surges and declines. As a reminder, if you go back to our map and you look at our epicurves and our data, it's clear that these ups and downs have continued and may very well be the hallmark of this response throughout the pandemic. And we know we're far from over. So I want to talk a little about the zip code map that we see in our data brief that we've looked at for many weeks. And there are a number of limitations that people need to recognize when they look at that zip code map. As I've said before, this map is not where people were exposed. It only represents where people live based on how the case is reported on their residence. People get exposed in lots of different places around the entire region. They could be at work, they could be during recreation, or during social interactions they have at parties or at a bar or at card games or dinners in someone's home, or people sort of cram too close together in someone's backyard for an extended period of time, or maybe they're on vacation. So equating, it's important that we do not equate the map to indicate risk at any geographic level. So the map is not meant to indicate risk at any geographic level. And COVID, like many infectious diseases, did not pay attention to municipal borders. It moves freely across borders and is passed to susceptible individuals no matter where they live. So it's important that people remember that. And the other thing I'd mention now is to date that we have now tracked over 16,000 cases and contacts in the 58 communities that we represent, of course, working in partnership with our City of Cleveland Department of Public Health, which is doing significant tracking as well. Our call center continues to be busy, answering complaints, questions about testing, and a range of other and sundry questions. And we've appreciated the support from the County Emergency Operations Center and Executive Budish and his staff in helping to assist with the volume of calls by supporting the work around the masking experience and working with us to then refer folks as necessary for a further investigation and follow-up. Most people want to help. Most people want to be part of the solution. But for those that are ignoring the requirements under the law around making sure you don't, if you're not social distancing and masking and issues in the workplace, we're going to assure that we focus on those places that appear to consistently be ignoring the rules. We want folks to make good faith efforts to comply. So we appreciate the state and local collaboration that we've had and continue to work closely at all levels to increase mask utilization in the community. If the Ohio Investigative Unit finds a place that is the Department of Liquor Control you've heard about, if they find places that aren't following the masking and social distancing rules, as you've heard reported, a violation will be issued and folks will have to go downstate to Columbus for a hearing where their liquor permit will be considered. And so those are important pieces for people to recognize. There could be a fine, there could be a suspension or revocation of the license, depending on how egregious the situation may be. So lastly, as a reminder, and a big thanks to all of our folks here at the Board of Health, what have been a remarkable, essentially 6 months of response now at 12 hours a day, 7 days a week in the fight against this virus. And we're going to continue our resolve to respond, and a remarkable group of people here working on your behalf as public servants. And so I'm proud to serve with them. And with that, I hand things over to Dr. Gullett, to Ramona Brazil, who will talk a bit about our case investigation and contact tracing work to date. Ramona?
Thank you, Terry. First, I just kind of would like to reiterate what we're saying about our health department. I want to acknowledge the continued work of our staff. We are a staff of less than 160 people, serving a health jurisdiction of more than 800,000 people. So under normal circumstances, we provide approximately 40 different programs and services throughout our health jurisdiction and throughout the region. And a lot of this work continues while responding to this pandemic. So I would like to personally thank our staff for continuing to rise to every public health occasion we have ever faced. This is the largest in scope, and although many of us are tired, we've dug deeper because we believe in the mission of public health and serving our communities. I've seen the personal sacrifices they've made to be here early, to stay late, and to work all week. We've all had our moments when we feel like this is too much, and we've continued to support and encourage each other in continuing this fight. I've always been proud of us and the work we do, and now is no different. So just to speak about cases, we did see a slight decline in the number of new cases reported this week. Last week we had 919 new cases. This week we had 855 new cases, and this represents our second highest week of reported cases since the pandemic began in our area. But it is a break, and I will take this break. We hope to see it continue to decline, and going down is definitely better than going up. We continue to operate 7 days a week, as spoken earlier, to meet this influx in cases. I am proud to say that we have been able to keep up with new cases, responding the same day or next day to new reports of cases, although we've had many days of more than 100 cases reported a day. We have had to make some changes in our processes to be able to shift staff to new cases to keep up. One important change to make the public aware of is we no longer provide discontinuation of isolation letters. People under isolation orders may be released from public health oversight after they meet all of the following criteria. It has to be at least 10 days since the onset of their COVID-19 related symptoms. If a person has tested positive but has not had symptoms or asymptomatic, it has to be at least 10 days since the date of that test. And a person needs to be fever-free for at least 24 hours without taking temperature-reducing medications like Tylenol or ibuprofen. And this is a change this week that came from the CDC as well as the Ohio Department of Health. It previously was 72 hours. And also improvement of COVID-19 related symptoms. So people have to meet all of these to be able to be released from public health oversight. We ask that people follow up with their healthcare provider to determine if their health status has improved enough to return back to normal activity. And what's important to note there is that, we do see people who do really well. They have mild disease. Some have no symptoms. Some are better in 10 days or 14 days. And some people have lingering symptoms for weeks and unfortunately some for months. So it really depends on the person, what it means to be fully recovered for them. Contact tracing does continue to be an important public health intervention in this response. And I would like to thank the Ohio Department of Health and the Region 2 contact tracers and their supervisors, Becky and Jennifer. Through their partnership, we've been able to catch up on contact tracing. which we got behind on after the influx of cases at the beginning of the month. We are now able to reach out to contacts within 1 to 2 days from obtaining their information again. And we feel like this is very important because time is of the essence to catch the spread of the disease. From our cases, we are getting information about close friends, family, and some work contacts. And unlike when at the beginning of the response, when we called people, the person that was diagnosed was often the only one who was already sick in the household. But now we are unfortunately finding multiple sick people in households when we reach out to their contacts. So that's definitely different now. And we are still hearing a lot of, parties and dinners, get-togethers, nights out at the bar that we feel are contributing to the spread of the infection in our community. Cases are a lot less sure about those contacts at those locations. So they may not be sure who was all there. They don't know the names or phone numbers of the people who were there. Therefore, it's more difficult to do contact tracing under those circumstances. So we may be able to follow up on close friends and family and household contacts, but it's much more difficult when it's a party or it's a dinner, etc. Earlier this week, our area hospitals released a joint statement reiterating their commitment to being ready to treat COVID patients in our community. And us as the health department continue to be committed to fulfill our public health duties. So we ask that the community continue to chip in and do their part and our part in continuing to do social distancing, wearing masks, and avoiding large gatherings. And with that, I'll turn it over to Dr. Gullett.
Thank you, Ramona. I'm going to spend a few minutes talking about some additional data, building on what Terry and Ramona already shared with you over the last few minutes. So in our EPI report for this week, you will see that we have greater than 7,500 cases now since the beginning of March when this first began in our community. We see about a little over 11% of those cases have been hospitalized at some point during their illness course, and nearly 3% of all cases have needed intensive care unit support. So that gives you a sense for the severity of this infection among those who live in Cuyahoga County. We also see that this was one of the most difficult weeks with regard to loss of life in our community. This week, we had 34 reported deaths among Cuyahoga County residents related to COVID-19. And I want to remind everyone that this is 34 families that have lost a loved one and 34 families who are grieving. And this is one piece of this that is very real. I know that if you haven't been affected by this personally, it might not seem like it is as severe as we tell you every week, but when you call families and you hear their stories and you grieve with them over their loss, it's very painful, and the reality of COVID-19 in our community is very real. So I would encourage you to continue to remember all of these families and to recognize this is the second highest number of fatalities in 1 week since this started in March. And we have grave concern that this could continue as a trend in our community. I also wanted to point out in our data brief, you'll see this, we continue to see significant burden of COVID-19 in communities of color in Cuyahoga County. The number of cases in this community that identify as African Americans, so this is self-identified race, continues to be higher than that for white individuals. So 45% of our cases identify as Black, while only 42% identify as white. However, when you compare that to an understanding of the demographics in our community, that is a significant burden on communities of color here. The same trend holds for both hospitalizations and intensive care unit support. That has been a trend that has held for quite some time. And again, this week, that is no different. I also wanted to highlight, as you see on the data brief, Terry also mentioned this earlier, but nearly 38% of our cases are in young individuals between the ages of 20 and 40. So we really recognize the impact of this on younger populations. And even though you may be relatively healthy, the ability that you have to spread this to people in your life or people around you who are sick and could be very sick from this infection and could have a negative outcome is very high. So we really need you to mask up. We need you to do everything you can to prevent getting this infection yourself. We also see the number of healthcare workers remains around 20%. Early in the pandemic, you may remember that it was higher than that, but that was really based on where we had been testing. And we tested healthcare workers early on because that's where the highest burden of disease was occurring. So moving along to the additional data, I want to talk a little bit. You'll see on the screen now is our Epicurve. And you'll see that this week, you can see our curve rising again. We have a really encouraging flat curve in the earlier months. That's what we all did by staying at home and wearing masks and doing everything we could. But as we opened up, you see our curve is no longer flat. And so our goal is to flatten it again so that we never reach that surge capacity. And below that, you'll also see the map that Terry already referenced. Again, this does not tell us geographic distribution of where people were infected. This simply tells us where they identify that they lived. So you cannot use this map to make local decisions in your immediate area about your risk. The risk is everywhere for all of us in Cuyahoga County and our surrounding Northeast Ohio area. This virus, as Terry has said many times, does not stop at municipalities or at any sort of jurisdictional lines. This crosses a lot of mixing across a lot of our communities. And so we really all need to be vigilant and wear masks. I'd next like to go on to the latter part of the brief that talks about hospital utilization. I want to make sure that people understand that when we present these data, we are simply talking about what the hospital utilization looks like for Cuyahoga County hospitals. Much of what you see the state represent in the color coding and the public health emergency levels is really around, some of the measures are around regional data. So I'm just telling you about Cuyahoga County because that's the community we serve here. But it's within the context of the Northeast Ohio region and our greater state. So for Cuyahoga County this week, we're pretty stable with regard to adult medical bed utilization. And I want to be clear that the percent, 82% that you see here, we have 82% of the adult medical beds are used currently. That does not reflect the number of beds that could become available if we had a surge. There are more beds that our hospitals are prepared to open up physically and to staff. And I really want to give a shout out to our hospitals and to the Center for Health Affairs and our Ohio Hospital Association for working tirelessly behind the scenes to make sure surge capacity is available. You don't see that, but I want you to know it exists. As far as intensive care unit beds and utilization for adults, you see that at 79%, and that's pretty stable. You can see the line up and down a little from week to week, but pretty stable. Medical beds for pediatric patients have been bouncing around a little bit. You see them in the orange line here at 61%. I wouldn't say that the change in 13% from last week to this week has any reflection of increased hospitalizations from COVID-19. We have had hospitalizations for those under 19 for COVID-19, including several in the intensive care unit, but those are not reflected in this week's increase. So these are likely admissions for other reasons. And then with regard to ventilator usage, we have 37% ventilator usage here. And again, all of these do not necessarily, or they do not reflect surge capacity in our community. We're very fortunate to have tremendous capabilities to take care of sick people in the hospital here in Cuyahoga County. And we want you to be abreast of what the situation looks like for our hospitals week to week. Finally, I'd like to talk a little bit about testing in the bottom of the EPI brief that reflects what the 3 hospital labs here, so those 3 in alphabetical order being Cleveland Clinic, Metro Health, and University Hospitals labs. They've graciously provided their aggregate, meaning full amount of data, not individual patients, but just a full amount that they do week to week since March. And this has given us the ability to understand roughly how many tests are being done and what the percent positive is, meaning the number of people who have positive COVID-19 infections compared with all of the people who were tested for that week. You'll see that our percent positive this week is down a little bit at 7.5%, but that's still high. for understanding where we would like it to be with regard to community spread. What this means is there is infection happening and it's spreading within the community. There were nearly 20,000 tests done this past week between those 3 labs. And this does not represent testing that was done at commercial pharmacies or that doctors or healthcare providers might have ordered in private labs like Quest, LabCorp, and others. You heard Terry reference earlier that our community testing plan, which we're so grateful to our county executive and his team for supporting, has tested over 6,100 people in the last 8 weeks. That doesn't include all the testing that we did as a health department even prior to March, during March and April. So from May to July, we've reached over 6,100 people with over 110 deployments of testing teams. So we're very grateful for the support of our county executive and Metro Health. Additionally, our percent positive for those cases, those 6,100 plus cases, is just under 4%. So that gives you an idea of when you were testing the general community, people who aren't sick, who aren't at the hospital, or not seeing the doctor, it was about 4% over those 8 weeks. However, the last 2 weeks has been a little higher than that. Still lower than 7%, but a little higher. To give you a general idea of what our community spread numbers look like. And finally, in our moment of gratitude today, you heard gratitude already from Terry and Ramona and from our county executive. I'd like to just add yet another one. One of the things that's gotten us through this as a team has been gratitude. Gratitude for one another and gratitude for the incredible partners in our community. So I would like to thank the Metro Health community testing team. They have taken on an increasingly significant role. They've always been a significant role, but they've actually taken over some of the logistical pieces from our team here as we have pivoted into more of the additional case calling and contact tracing and cluster management and outbreak investigation. And we are incredibly grateful for that additional support. So all of those 110 plus deployments, those thousands of people who've been tested, in large part due to the amazing team, all the way from Dr. Boutros and his highest level leadership to the people who are actually scheduling and out testing. And we are so grateful for every single one of you and what you're doing for our community and in partnership with public health. So with that, I will turn it back to Mary Louise and we will proceed to questions.
But we have time for some questions. Anybody? Hearing none. And I have no texts.
This is Courtney Astolfi with Cleveland.com. Can you guys hear me?
Hi, Courtney. Yes, we can.
Hi,
We can hear you. Thank you.
Thank you. Little different protocol to be able to speak on this call. Sorry about that. I was hoping to zero in on something that Dr. Gullett brought up and something that caught my eye in the numbers. This week's death rate. It seems to be the second highest death rate we've had since this all started. You know, the past couple of weeks, you guys have been talking about, you know, we're seeing a lot of younger folks, you know, getting sick. That's where a lot of the spread has been. Can you kind of share more thoughts about why you think we saw such a high number this week for the number of folks we lost?
Thank you for that question,
COVID?
Courtney.
Yeah.
This is certainly one of the most gut-wrenching parts of this response. And I do a lot of thinking about this because every time a death's reported, you know, a part of us is gone in this community. And so we've got to think about how we minimize loss going forward, as we have been since the beginning. But this toll continues to rise. I want folks to understand that fatality numbers lag behind reports of active infections. So sometimes we are notified immediately when someone expires. So the medical examiner, you know, Dr. Gilson and Hugh Shannon and their office they notify us daily, but only a certain percentage of cases are reported to them in real time or at all. And so we are also reliant upon other forms of notification. And sometimes those are delayed, such as death certificates. So we oftentimes will get reports of people who died a few weeks ago and we didn't know about them. So I can tell you this week, you know, we definitely had people who were reported from a few weeks ago. And so when you see any death, you know, fatality numbers or deaths reported, you can't assume that those all occurred during that particular week. They were just reported to us during that week. And so when we look back, this really reflects what's been happening in our community over the last 2 to 4 weeks, which we see in our other numbers in the real-time increase of infections. I will also point out that this is not only deaths in people who are in their 70s, 80s, 90s, and 100s. We have had deaths as young as 36, multiple deaths of people in their 40s and 50s. So, you know, just like the median age for cases has come down, we are seeing the median age for fatalities also lower to some degree. So the message here is that this is a high risk for everyone in our community, and everyone is at risk. But I wouldn't read too much into specifically what happened this week, because it really reflects what's happened in subsequent or prior weeks.
Thank you.
Anyone else with a question?
Hi. I guess that just, oh, go ahead.
Oh, sorry. Can I go? This is Anna Huntsman from IdeaStream.
Sure. Thanks, Anna.
Hi. So, Dr. Gullett, I heard you were talking about our ICU bed capacity and hospitalizations in the county and how it's pretty stable. I just was going to ask about at the press briefing yesterday with the governor, he mentioned that hospitalizations, at least in the state, are kind of reaching a new high, and that this could, he used the words a tipping point, kind of like we could either go either way at this point based on our actions. So I was wondering if you could speak to just sort of, again, with the county, how we're feeling as far as capacity goes in the hospitals, and whether we're prepared for a surge or whether we're seeing higher numbers, just sort of if you could comment to that regard.
Sure, thank you for that question. So we always consider our numbers here locally in the context of the region and of the state. We're, again, not limited by borders. People come here to Cuyahoga County for very high quality medical care in all of our health systems. And so we're always seeing a reflection of people, not just Cuyahoga County residents, but people who live, you know, really all over Northern Ohio, in those who are hospitalized here. So it is important to consider where we are with regard to the region and where we are with regard to the state. But we do have a lot of capacity here. And so relative to other communities where they may not have multiple hospitals in the community or multiple intensive care units in the community, we have a lot of beds and we have a lot of skilled care providers, nurses and respiratory therapists and others. And so I think you see relatively stable numbers from the county level here, from what I've been showing you and the graphs that we put together since March every week. But when you think about what that looks like for the whole region and as well as the state, you know, the governor has to look at that from a state perspective, and that may not be reflective of the immediacy of what we're seeing here because of our high level of capacity. But that doesn't mean that we can let our guard down. That does not mean that we can say, well, we have a lot of beds, we have a lot of surge capacity, we can let up around here. We are red, and we were knocking on the door of purple a few weeks ago. So we've really got to be vigilant, because if that curve reaches over the surge capacity, those are decisions that none of us ever want to have to make. We never want to have to make decisions about who receives care because we don't have ventilators or ICU beds. So that's what we're all trying to prevent. We're trying to prevent, and another week with 34 fatalities reported. So that's where we're at. Terry, do you have anything else you wanted to add?
Maybe one thing.
Thanks, Anna.
Just one thing, if I may add, Mary Louise and Anna, is we have on our board, we're fortunate to have a pulmonologist, Dr. Sherry Williams, who is with us and has been a fantastic resource and sharing information from the clinical setting. And Dr. Williams reminds us, and it stays with me, is that no one wants to make a decision a pulmonologist or anyone else in the clinical setting about who's going to get a ventilator and who isn't, about who gets the opportunity to live based on quality of the years left that they may have on some calculation, and who doesn't. So this is serious business, folks, going forward. The masking concerns people have about freedom. In my view, the masking is our way to freedom, is our way back to economic improvement in our community. It is the only way back. No one wants to push the list there. And at some point, folks, none of us wanted to be our grandmother or our father or the little kid down the street with leukemia who is in the ICU, because maybe we unknowingly exposed them because we felt fine at the time when we interacted with them, but we did it without a mask and we did it in close distance and we put others at risk. As a community, we have that shared responsibility with each other, and it is sacred. And so those are the things I think that need to drive us forward in those moments, is recognizing what we have the power in our community to prevent. And that is people from dying and seeing these increases that are beyond control. Now is the time to act.
Thanks so much for that context.
Thank you, everyone. Any other questions? We have time for another one. All right. You all know how to get a hold of me if you have any follow-up questions, or the Board of Health. And that's it. And we will let you know the next time we have another.